Good morning, friends. Thank you for joining this morning on Community Coffee. I'm Trena Myers, aka the Zebra Queen, and I am your host for Community Coffee. Thank you for the prayers and the uplifting as we have lost our co-host Renee. But you know what? She would have not wanted anything more but for me to forge forward with Community Coffee. I know she's here in spirit. This morning we are going to have Caitlin Page, Miss Florida Global Continental, with us. Unfortunately, as somebody with a rare, you just never know what from day to day is going to be like. So I'm just asking you to keep her in thoughts and prayers as her rare has flared up and has given her some issues. So, Caitlin, if you're watching, just know that we are thinking about you and we just want you to rest and heal and feel better. I had one of those days myself yesterday. I just pretty much laid on the couch and just rested. So, without further ado, this obviously is not Caitlin with me. I wanted to introduce one of my greatest friends that I have gotten to get very close to, and we talk almost every day, and no other than the Rare Strides co-founder, Beth Nguyen. Thank you so much for joining me today on our last minute add to Community Coffee. Thank you for joining me, Beth.
It's an honor to be here, Trena, honestly, and just share on behalf of the Rare community.
Now, for whatever reason, I am not able to hear you. Oh no, let me see if there is something going on my end. Okay, let's try this again. Let me see if I can hear you.
It's an honor to be here,
No.
Trena.
Okay, I'm just going to have to take my microphone out, I believe. Is that better?
Can you hear me?
Yeah, it's my microphone. I'm going to have to mess around with it and see what's going on. But I don't have time for that this morning. You just got to go with the flow and take it moment by moment sometimes, right?
Exactly. It's all about tackling one Mount Everest at a time, as I like to say. It's an honor to be here. And certainly, yes, I'm here on behalf of the Rare community, and it truly is an honor to serve. So thank you for having me.
Yeah. So Beth and I actually met through LinkedIn, which is a really funny story. I actually lived just right around the corner from her, not knowing this. We had connected on LinkedIn, and she had no idea that I had a rare. So it just was, the divine bringing us together to be able to work on this amazing opportunity and growth for the rare community. So, Beth, can you tell us a little bit about why did you start Rare Strides, and tell us a little bit about what it is?
Sure. So everything that has happened in my life has been a big part of my journey and faith in God. It's part of my prayer journey. And working as a nurse, for 15 years in different areas of medicine, when I started having symptoms and became very sick, no one knew how to help me. Even with all my experience and critical care training, I did not have the appropriate resources to help me find answers. And even members of my medical team were left scratching their heads. They really had very little resources to support my journey. And so from onset of symptoms to diagnosis took 5 years. And by that time, I had already developed irreversible complications, including heart failure and pulmonary hypertension. So, for a time, I was extremely frustrated, as you can imagine. And I thought to myself, goodness, what can I do to try and help other people that might encounter the same sort of obstacles and challenges? Because certainly I knew that with my experience in nursing, as well as my knowledge of medical care and looking at the journey, my own journey, that there was more that I could do. So along those lines, I started getting heavily involved in the rare community and learning more that their challenges and struggles and barriers were similar to my own. And I also spent time interviewing with medical teams to say, hey, how can we help to break these barriers down and remove the silos, if you will, so that everyone can understand what rare diseases are, so that when children and adults go to seek care, whether it's primary care or neurology or specialist, everybody will have access to the same information, so that we can move forward. And really that journey, from my own journey in nursing to the launch of a 501c3 nonprofit to advocacy at the state capitol, all of my experiences over the years culminated in starting Rare Strides, because it became apparent that there needed to be a voice in healthcare that was all about giving back to patients and families in the rare community. I found I'm a real big believer in not reinventing the wheel and in reaching out and speaking to others that were currently in the healthcare space. Really, the perspective that we bring, the leaders that I have connected with and been blessed to have on the Rare Strides team, are unlike any other. They have personal experience with the rare journey. They certainly understand the hardships and barriers. Many of them have master's degrees in the healthcare space, so they also understand the barriers that medical teams encounter. So using that perspective is very powerful. And in bringing the team together for Rare Strides, we feel like we have a very unique way to empower both patients and medical teams to make a difference moving forward through our programs, which I'm excited to tell you about.
Yes, I can't wait to hear. Well, I mean, I know because I've been working with Rare Strides, but I can't wait for our viewers to hear about all the different campaigns and programs that Rare Strides can offer to them.
Sure. So in applying, I think that in talking about the programs, it would be easily explained by sharing the journey of one rare disease patient. So applying that to myself, we have programs called Code Rare. It's all about getting CME and education into clinical settings that's focused on rare diseases. The way that we do that is we reach out and we collaborate with 501c3 rare disease nonprofits. We want to highlight all the amazing resources that they have available to medical teams and to patients and families. Many times, my medical team, for example, did not know where to find specialists in syringomyelia. They did not know what the current trends or what research trials were available, for example, if there were any therapies that were promising, just to name a few. Those are important resources to share with members of the medical team. It also would have been beneficial to me to have access to those resources at the beginning of my journey instead of 5 years later. It would have been helpful to know what the red flags were for my disease, what test may have been beneficial. And through Code Rare, we are excited because we're able to bring all of this vetted information forward through our nurses and through our state leaders and ambassadors that we have positioned all over the U.S. What we want to do is bring this information forward through training days and events. Going a step beyond that, we have this amazing Make Rare Visible campaign, which is all about sharing how you want to make rare visible in healthcare. It also provides a way for patients and families to share their journey through podcasts and blogs. We have opportunities for patients, families, and medical teams. I cannot emphasize how important it is for patients and families to share their journey. Because unless we talk about some of the barriers and challenges, how can we ever hope to address them? It was very difficult to come out and talk about my journey as a nurse with a rare disease. I was afraid. You know why I was afraid? I was afraid because I thought that my colleagues would laugh at me, maybe
You feel like
minimize.
your credentials are not as
Mhm.
strong if you have a rare disease. Like, how can you be creditable? But that's
Right.
far from truth.
You know, I've talked to many colleagues in the medical space who have a rare disease, and they are afraid too. They're afraid to talk about it because they're afraid of backlash, they're afraid of judgment, they're afraid of what other members of the medical team might think. And I'm here to say that I've been there. I've done that. And you know what? I have the respect of my colleagues. Many members of the medical team have reached out and said, you know what? This journey is very powerful, and more members of the medical team need to stand up and speak out when they face a rare journey. So I'm asking my brothers and sisters to stand up with us and talk about what are some of the barriers you see, and let's go a step beyond that, and let's work on positive solutions together.
Absolutely.
Yeah.
I mean, we're only adding detriment to our community by not speaking up about it. We're putting more debt into the healthcare because we're not speaking enough about it, or others, healthcare providers, et cetera, are not speaking up about it because time after time people are ending up in the emergency room having all these, the tests that are being done are not tests that need to be done. And so it's wasted money instead of doing the tests that need to be done to find the answers. But because the education, as you and I both, the zebra comes into play of why is it a zebra? Why is rare associated with the zebra? And it's because the medical doctors are taught in medical school to listen or not to listen to the hooves of zebras because they're rare. And so, I know myself and you as well, we were diagnosed much later in life. And there were so many other tests that were done that was not necessary. Or I myself was put on tons of different medications that just made me sicker. I became toxic from those medications that I didn't need because of a misdiagnosis, because the right test had not been done. So you're absolutely right. We need to just speak up and make a change in how rare is looked at.
Well, you're absolutely right there. And I think that another perspective that we share is at Rare Strides, we have this incredible tool. So we are building a mobile app that communicates with a clinical portal. And we certainly have a rare model of care delivery system and interactive diagnostics that we're going to bring to the table, all with the goal of giving back to strengthen the rare community and providing a free resource for patients and 501c3 nonprofits. our educational tools will always be free to medical teams because we don't want to create more barriers for the rare community. I think that one thing that we share in terms of a perspective, everyone is hunting for the diagnosis, right? The
Yes.
magical answer.
Right.
And we take it back steps before that. We started Rare Strides back in 2016 with a focus on finding the next step in care. We're not just focused on the diagnosis, we're focused on finding what is the right step. And we're not saying that doctors don't need to look for the common things. They can, and certainly I think that it's helpful to rule out all the things that we think it might be, right?
Absolutely.
But when there's not an answer and when we're not sure where to go next, that's when we should all think, wow, let's rule out a rare disease, right?
Right.
Because we don't know what it is. And if 5 years passes by and we do have a rare disease, I don't want anybody else to end up with heart failure and pulmonary hypertension like me while the time clock ticks away.
Absolutely. And I've lost many organs from it. Yeah. And unfortunately, there's people who've died because of it.
I've had friends and colleagues that have passed away, and I promised each one of them, look, your journey is significant, and we will make sure that through Rare Strides, we honor your journey. We're not going to forget, and we will build upon the lessons learned from what you went through and apply it so that we don't go back and repeat the same steps that led to what happened, right? We have to change, and healthcare in the US has to change. There's so many things that don't work for patients and for medical teams. It's time for something new that can really be beneficial to everyone. And we have to work together. If we don't do that, we can't make the kind of progress that we want to make. So,
Absolutely. And that's why it's so important that we work together
mhm.
to make rare visible.
Yes, absolutely. We also have a program called Rare Wish, which is extremely exciting.
Yes.
It is a program where we are giving back to grant wishes for children and adults with rare diseases. It is such an honor to do that. We had one child's family who shared the journey through Code Rare, and I'll tell you, he's going to be one of our first wish recipients. It's very exciting. This child's journey, just to give you an idea, for 10 years, every time the family would call 911, there would be missteps that would lead to repeated hospitalizations and ICU stays. And implementing Code Rare and the medical education tool, just at its pilot level, applying it to one journey, for the first time in 10 years of life, this child did not have to stay in the hospital, did not have an ICU stay. So in looking at a combination of the Code Rare education, the Make Rare Visible, learn about my journey, and Rare Wish, it is extremely powerful. And I'll tell you, for me as a nurse and a mom, knowing that we can eliminate pain and suffering and give back just a glimmer of hope to a family who is suffering so much, that is so rewarding. It's what I wake up for.
Absolutely.
So
Well, I
it's a
know
blessing.
that, this month is World Rare Disease Day at the end of the month, February 28th. And so that's one of the things that I know Rare Strides and as myself are really ramping up and trying to spread the word and the awareness in February to end at the end of the month on Rare Disease Day. And a couple of things we're doing is we've got a fundraiser that myself and Miss Florida Caitlin Page are raising money for Rare Strides and Rare Wish to help grant another wish in May for an exciting opportunity that Rare Strides just found out about and started sharing information about that. So, what's going on in May?
So in May, I'm very passionate about making sure that we honor those who are going through a rare journey, but that we also make rare visible everywhere. So in May 7th from 5 to 9, we are having a glow in the dark concert. It's all about making rare visible in medicine. So we invite the community to come out, dress and wear some zebra stripes, right, to support the rare community. If you are at home, we are working diligently to try and make sure we can live stream this concert so you can participate as well. We encourage you to wear the zebra stripes and share the hashtag Make Rare Visible. We encourage your creativity. And, I will be there. Trena's going to be there. There's several of our team members that are going to be there to meet and connect with you, to share the mission of Rare Strides, and to give you more information about Rare Wish and our Code Rare program. It was decided to do the concert because there are some rare diseases that children and adults can't come out in the sunlight. So we wanted to do this in the evening time. And we're also wanting to add a component where if you have lost a loved one or you would like to remember someone who is going through a tough time, whether they're in the hospital or perhaps they're not able to join because of what they're going through, then we are going to have some lanterns available to light up in the evening hours. And our t-shirts, we are hoping we can have the Make Rare Visible component on them glow in the dark, so that when you are enjoying the concert and just having a good time and knowing that we honor you, you can just relax. You don't have to do anything. It's just going to be a fun time of fellowship and community to come together and say, you know what, we honor the rare community. It's important to make it visible in all areas of medicine, and we are here to support you. So we call on community members, leaders, just come out and have fun.
Absolutely. And that information can be found on the Rare Strides Facebook page, events. I also will share it on my social media. I believe I have, but if not, I'll reshare it. I also have the 3K information on my social media, where Caitlin and I are doing a virtual 3K, Make Rare Visible. And that will also have a t-shirt that participants will receive to encourage those that are supporting rare diseases or have a rare disease themselves. And again, that money will help go fund the Rare Strides and Rare Wish campaign. Beth, I do have a question from one of the viewers.
Sure.
I think I know, I know the answer, but you're my guest, so I'm going to let you answer it. The question is, Rare Strides, does these campaigns apply to patients with all health inefficiency that people endure, or is it focused on a particular disorder?
Rare Strides is here to support undiagnosed diseases that can present with a number of complexities. We're also here to represent over 7,000 rare diseases. And certainly we do support the journey of those that are going through a rough time. Maybe you haven't been diagnosed and you have a ton of complex symptoms. Rare Strides is here for you as well.
Absolutely. And one way that they can reach you is either through Rare Strides social media or info@rarestrides.com, correct?
Yes, absolutely.
All right, wonderful. Also, one of the other components to Rare Strides is an advocate and an ambassador program that you have where people can get involved on a volunteer basis
Mhm.
to help share the word and help make Rare visible. But also, if they are in some sort of healthcare capacity, that's where the ambassador comes into play to help with setting up CME credits, actual educational workshops for healthcare teams.
Exactly. We welcome community leaders or individuals that are passionate about Rare to inquire about the Code Rare Ambassador Program and the program for advocates. If you are a nurse or another member of the medical team, we are looking to add additional leaders into our Nurses Speakers Bureau. And also, we welcome medical team members to join Grand Rounds, where we can work together to solve challenges for the Rare community. So we're growing at a rapid pace, and we welcome you to join us, and certainly reach out at info@rarestrides.com, and we will get back to you with that information.
And these are free services.
Yes, it's all free.
That's an added perk. I know working in nonprofit, you hear the word free and it's like, what? Yes, sign me up.
Rare Strides is all focused on giving back to the Rare community, and so we really do have a heart for those with Rare. Rare Strides is a for-profit entity. However, we are all about giving back to nonprofits and patients and families in the medical space, and certainly our Rare Wish program. The funds that go into our Rare Wish Fund are donated back to 501c3 nonprofits with the intention of granting wishes for children and adults with Rare. That's what it was designed to do. We felt like we had to go into that space in order to make the traction in medicine that we need to make. I launched a nonprofit years ago with the hope that we could get information and tools into the bedside, and unfortunately, it doesn't work that way. So I am an advocate. I am a leader in the rare space, and my heart is all about supporting patients and families with rare diseases. So you have an ally in healthcare.
Yes. And I think that's what's so unique about Rare Strides is that the model is something that you just don't usually see. It is rare in itself that you have a for-profit working with a nonprofit kind of mindset.
Yeah. And that is what we are. We have a heart to give back to the rare community, and that's why Rare Strides was launched, so we can. Yeah.
Right. And this is not just so, Beth, you're located in Metro Atlanta, where I was living.
Mm-hmm.
And I just relocated to Southeast Iowa, and I'm starting a new journey of finding the right healthcare providers for myself, which has been a challenge. I'm in a rural community in Southeast Iowa, and I'm not going to lie, it has not been fun. And so you and I have been communicating on efforts on how to make changes in rural Iowa as well. And I've reached out to legislators, et cetera, to help me on that journey. So it's not that South or Rare Strides is only in the Atlanta area. This is something that is available across the U.S.
Mm-hmm. Absolutely. We launched with the intention of being in the U.S. and also having connections overseas as well. So as we grow, we will continue to reach out, but this effort is something that will continue to grow worldwide. So regardless of where you are, please contact us and get connected because we want to support your journey.
Absolutely. One last thing before we wrap it up, because we're coming up on the 30-minute mark, and I try to keep these around 30 minutes to keep our viewers' attention. So one of the questions I was asked was, where is the concert? And that is going to be in Swanee, Georgia.
Mhm.
at the Swanee Town Center Park. It's a really nice greenway that has an amphitheater, plenty of parking. So we're hoping that this turnout is going to bring in hundreds of people.
Yes, and if you're worried, it is accessible. So please don't worry about that. If you have a wheelchair, if you use medical equipment, as I do, it is very accessible to get around. They're very good at that, and the restrooms are accessible. So please come out, enjoy yourself, and certainly I'd love to meet you while you're there.
Absolutely. And if you are viewing this on a replay, just hashtag replay so we know that you have joined in and supporting the rare community. If you're interested in holding a fundraiser for Rare Strides or Rare Wish, you can definitely reach out to us because, as we mentioned, this is not something that is just in Atlanta, Georgia. We are wanting to get resources across the U.S. So, just like Miss Florida, Global Continental, Caitlin Page, and I are doing the virtual fight, our 3K, because our goal is to raise $3,000. So we said we're going to do a 3K. You in your area can also help us with fundraisers. It doesn't have to be in a particular location, it can also be done virtually. So, with that being said, we will post the links to Rare Strides in the comments after we get off the live. For more information, you can reach out to Beth at info@rarestrides.com. You can also reach out to me in the comments or in a direct message, and I can also get you connected with Rare Strides. So thank you so much for your time today, Beth. I look forward to having you on here again as our focus is bringing positivity and enlightenment in the community and sharing what is going on in different communities and how we all can get involved to make a difference.
Thank you so much for having me. And if you're watching and you have a rare journey or rare, we see you and you are visible. So thank you for all you do. We look forward to connecting with
Absolutely.
you.
And so in the meantime, just watch my post, and I'm going to have different ways that you can help make Rare visible. On Mondays, I wear stripes to help make Rare visible because of the story about the zebra. And then on Wednesdays, I wear blue because we're blue zebras. Halfway through the week, it's no longer camel hump day. Okay. It is now blue zebra day because us zebras are holding our breaths. We've made it through halfway through the week. Now we're holding our breaths to make it through the rest of the week. So you can join us on those two challenges and hashtag make Rare visible. And then on Rare Strides social media, we also have a Make Rare Visible challenge going on. And those steps on how you can participate are listed on those social medias. And at the end, you will get a sticker or a social media profile photo thing that you can use to help show that you are supportive of making Rare visible. Well, thank you so much for joining us, and I hope that you all have a wonderful rest of your day and kicking off the week to make it fantastic.